Are your eyes itchy and dry? Well, in Health Matters, we have the place for you. It's the Dry Eye Clinic, and Dr. Schiff is here with me. And this is really great, Doctor. I'm glad you're here because, one, it's rainy out, so we know that kind of affects people a little bit and getting the dry eyes, but we live in the desert.
Exactly.
And let's remind people, Dr. Schiff, where you're from.
I'm from Barnet Dulaney Perkins Eye Center.
Yeah, and I didn't know there was a dry clinic there, a dry eye clinic.
Yeah, we do have dry eyes. Over 3 million people in America have dry eyes.
Wow.
And working on technology, computers, smartphones, living here in the desert certainly contributes to that 3 million.
Yeah. Well, you just said something I didn't even think about, but you just said technology, just looking at the computers, can dry our eyes out?
Oh, absolutely. When we work on computers, our blink frequency decreases by 50%. And so what's really happening is we're getting an evaporative dry eye.
Okay.
So our tears are evaporating off our eye.
Wow, I didn't realize that. So, I mean, what about drinking water? Is that way to help? I mean, you hear that a lot. Or let me give you two things. Drinking water and eating carrots, as my mother said.
I think both are excellent.
Are they?
Yeah.
So those are important.
Yeah. But one of the things I like to tell my patients to help when they work on computers for a long time is what I like to call the 20-20-20 rule. And what that is every 20 minutes, you should take about 20 seconds to just close your eyes, blink, maybe put some artificial tears in, and then look out and gaze beyond 20 feet. And that just kind of relaxes the focusing system and kind of helps the eye hydrate.
Wow, okay, let me ask you a question. I get the little flickering. Is that dry eye like when I'm doing that, or is that something different?
No, that's something different, and many people can have floaters or flashes, and when people have floaters, flashes, or little flickering, they really should have a dilated eye exam.
Okay, so that's important. And I like what you brought here because this kind of like helps out for you guys to see if people have dry eyes? No,
actually this is an instrument called the iLux that we can treat dry eyes.
Oh, is that? Yeah. Oh, cool.
Yes. So this is an FDA-approved device. We have oil glands on our upper and lower eyelids, and those clog up with bacteria or just dead skin. And what happens is the sebaceous fluid that comes out is very thick. It's not a healthy fluid. It should look like olive oil. And this device heats the eyelids, expresses out the oils out of the eye, so that we have a better quality of oil and a better quantity of oil, and that oil is to keep the tears from evaporating.
Nice.
Something we just do in the office takes about 15 minutes.
So, one of those people who kind of like say they don't have tear ducts. I mean, is that true? I really want. I mean, I hear people. I don't have tear ducts, so I can't cry.
I think most people have tear ducts, but there are some medications, some disease of the body that can prevent the production of tears.
And that's where you guys come in, because it's very important to come see you for your eyes. I mean, they're most important things. So when people are having those problems, you know, to come by and get them checked out.
Get them checked out, exactly.
So, and nothing to be scared about. I got to tell you, I like sitting here with Dr. Schiff because I just asked about eye problems. He's like, Brad, come get checked out. So I was trying to do, I'm getting an exam here, eye exam, which is really good.
Yeah.
So, and that's what you want people to do, especially as we're starting to get into the drier times, to come take care of those eyes.
Yep. We have other easier ways to treat dry eyes. We can use artificial tears. You can get those without a prescription in the drugstore. We have some medications that we can prescribe for dry eyes as well.
So I love it. All right, where can people find out about that?
Oh, at Barnet Dulaney Perkins Eye Center.
I love it. And then, of course, there's a website you said it's also kind of cool to go to.
Yep, the website is goodeyes.com.
I love it. There you go. So thank you very much.
Oh, you're welcome.
And what I'm going to do is I'm going to need you to take a look at my eye.
I know.
Okay.